Hello, my name is Camilla Tonkin from the University of Charleston. This is my pediatric presentation for Nursing Course 240 at the University of Charleston with Professor Janet Lilly. Aplastic anemia. What is aplastic anemia? Aplastic anemia is a form of bone marrow failure. It is characterized by bone marrow aplasia and pancytopenia, which is a decreased number of all blood cells. The bone marrow is the factory for all blood cells, red and white cells, and platelets. These cells are critical for supplying oxygen and nourishment to other tissues and organs, fighting infection, and clotting the blood. As old blood cells die, they are replaced by new blood cells formed in the bone marrow. In aplastic anemia, the bone marrow does not produce new cells, leaving the body susceptible to bleeding and infection. Who does aplastic anemia affect? Aplastic anemia primarily affects children and younger adults, but can occur at any age. Is aplastic anemia acquired or inherited? Most cases of aplastic anemia are acquired, but there are a few rare types of inherited aplastic anemia. The inherited types present as congenital bone marrow failure. Acquired aplastic anemia is thought to be an immune-mediated response. Most cases of aplastic anemia are idiopathic, meaning the trigger is unidentified. Other causes include exposure to environmental toxins, viruses, myelosuppressive drugs, or radiation. How is aplastic anemia classified? Aplastic anemia is classified as severe and non-severe. In the severe form, the granulocyte count is less than 500, the platelet count is less than 20,000, and the reticulocyte count is less than 1%. In non-severe aplastic anemia, the granulocyte count is about 500, the platelet count is over 20,000, and the reticulocyte count is over 1%. What are the symptoms of aplastic anemia? In patients with aplastic anemia, the red cells, white cells, and platelets are much lower than normal. Symptoms like unexplained infection, unexplained bleeding, and fatigue can cause the physician to suspect the disease. Overall, the most common symptoms of aplastic anemia include significant fatigue or weakness, bruising and bleeding easily, shortness of breath, recurring infections and/or flu-like symptoms, the appearance of small red dots on the skin that indicate bleeding under the skin, headache and fever due to infections. Patients identified early through abnormalities seen in routine laboratory testings may have no symptoms. Complications of aplastic anemia. Complications of aplastic anemia include severe infection, hemorrhage, and death. How is aplastic anemia diagnosed? To diagnose aplastic anemia, the cells of the blood and bone marrow must be examined under a microscope. To do so, blood and laboratory tests are performed as well as a bone marrow aspiration and biopsy. A sample of bone marrow is removed from the hip bone using a special needle while under a local anesthetic. The physician will check the number of red and white blood cells and platelets present. How is aplastic anemia treated? Treatment for aplastic anemia depends on the severity of your condition and your age. Treatment may include observation, blood and/or platelet transfusions, medications, or bone marrow transplantation. Platelet transfusions are typically the first course of treatment. These transfusions reduce the high risk of suffering a fatal hemorrhage. Red blood cell transfusions can help combat fatigue and shortness of breath. Transfusions may stabilize aplastic anemia patients, but it is very rare for a patient to achieve long-term recovery from this form of treatment alone. When age, other health-related factors, or the inability to find a compatible donor may make a bone marrow transplant too risky, aplastic anemia is treated with medications. While drug therapy is not a cure, it may partially restore blood cell production. Up to 50% of patients relapse or develop other blood-forming malignancies or disorders. Treatment continued. Aplastic anemia is one of the first diseases for which bone marrow transplantation was successful. The patient's non-functioning bone marrow is destroyed with drugs and/or radiation and replaced with donor marrow from a compatible donor, usually a sibling or other family member. When successful, bone marrow transplant is often a cure for aplastic anemia, with few incidences of relapse. Bone marrow transplantation is a very intense therapy, and serious immune complications and infections are not unusual. Caring for a patient with aplastic anemia. Safety is the biggest concern in children with aplastic anemia. It is very important to prevent injury in order to avoid hemorrhage. It is also very important to monitor for signs of infections like a fever, because an infection may be life-threatening.